As we go through our workday, we touch a lot of surfaces, some of which might be contaminated. Millions of workers every day are at risk from contaminations called blood-borne pathogens. Blood-borne pathogens are present in infected human blood and certain other bodily fluids, and some of them carry potentially fatal diseases. No matter what kind of work you do, you should always be aware of the risk of exposure to blood-borne pathogens, because when you know the risk, you can take precautions. You can be exposed to a blood-borne pathogen by touching an infected person or their secretions, or you can be exposed by touching something that has been contaminated by an infected person. So how do you protect yourself? You have to understand that something can be contaminated and the infected organism may not be visible. For example, linens, tabletops, washrooms, door handles, anything that may have been used or touched by someone else can spread a dangerous germ or virus. When you come into contact with an infected surface, the organism can transfer to you. Once it is on your body, any body opening can allow this pathogen to enter your system. This includes your nose, mouth, eyes, other body openings, any mucous membranes, and any cuts, abrasions, or any other breaks in the skin. For example, if an infected person coughs or sneezes on a table which is not cleaned after use, and then you touch the table with your hands, the infection may now be on your hands. If you rub your eyes or eat anything, the infection can pass into your system. This can be prevented by following simple guidelines that will protect you from exposure. You don't know if someone with a contagious disease has touched a surface, so good hand washing is the first and most effective method to prevent spreading infections. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected, and use proper gloves before cleaning anything that may have been exposed. Wash your hands before putting on gloves and immediately after removing them. If soap and water is not available, you can use a waterless hand sanitizer. Never touch clean objects with contaminated gloves, and avoid touching your face, eyes, nose, or mouth until after you have washed your hands. Protect yourself from blood-borne pathogens, use appropriate disinfecting agents, and use proper hand washing techniques. Thanks for watching, and have a safe day.
Blood-borne pathogens. OSHA 29 CFR 1910.1030. Freely available training for your staff. Please share and subscribe. Blood-borne pathogens. Course objective. Students shall understand and be able to describe what is a blood-borne pathogen, HIV, hepatitis B, hepatitis C, and how they are transmitted. Guidelines for handling blood-borne pathogens and other bodily fluids. Universal precaution. Personal protective equipment (PPE). What to do if an exposure occurs. Decontamination and sterilization procedures. Introduction. OSHA's blood-borne pathogens standard prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Implementation of this standard will not only prevent hepatitis B cases, but will also significantly reduce the risk of workers contracting AIDS, hepatitis C, or other blood-borne diseases. Blood-borne pathogens. As a universal precaution, treat all human blood and certain body fluids as if they are infectious. Definitions. What does blood-borne pathogens mean? Blood-borne pathogens means microorganisms that are present in human blood or other potentially infectious materials that can cause disease in humans. What types of diseases are there? Blood-borne pathogen diseases include, but are not limited to, hepatitis B virus (HBV), hepatitis C virus, HIV, which causes AIDS, malaria. Definitions. Occupational exposure means reasonably anticipated skin, eye, mucous membrane, or potential contact with blood that may result from the performance of an employee's duties. Reasonably anticipated exposure includes the potential for exposure as well as actual exposure to blood or other potentially infectious materials, APIM. It includes exposure to blood or APIM, including regulated waste, as well as incidents of needle sticks. This definition does not cover Good Samaritan acts, that is voluntarily aiding someone in one's place of employment, which results in exposure to blood or APIM. Definitions. Parenteral, such as an injury with needles and sharps. Prenatal, virus can be transmitted from a mother to her infant during pregnancy. PIM, potentially infectious materials. PPE, personal protective equipment. Transmission, how do you transfer pathogens? 4 ways to spread germs. Transmission of germs. 1. Airborne or respiratory route. 2. Direct contact route. 3. Fecal-oral route. 4. Blood contact route. Other potentially infectious materials, APIM. Bodily fluids including semen, vaginal secretions, synovial fluid, pericardial fluid, amniotic fluid, saliva and dental procedures, and any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between bodily fluids are to be assumed infectious. Any unfixed tissue or organ from a human being, such as torn skin, HIV-containing cell or tissue cultures, organ cultures, and HIV or HBV-containing culture medium or other solutions, and blood, organs, or other tissues from animals infected with HIV or HBV. At risk. You are always at risk for BBP. Why should you care? Approximately 5.6 million workers are at risk of exposure to blood-borne pathogens such as HIV, the hepatitis B virus, and the hepatitis C virus. OSHA's blood-borne pathogens standard prescribes safeguards to protect workers and reduce their risk against the hazards from exposure to blood and other potentially infectious materials. Every organization must have by law a specific written safety program regarding blood-borne pathogen safety and safeguards. Who is covered by the standard? All employees who could be reasonably anticipated as the result of performing their job duties to face contact with blood and other potentially infectious materials. Some workers are at risk. Some jobs within the city that are covered by the standard. Wastewater treatment workers, medical waste treatment employees, law enforcement personnel, physicians, nurses and emergency room personnel, orderlies, housekeeping personnel, and laundry workers, dentists and other dental workers, laboratory and blood bank technologists and technicians, medical examiners, morticians, firefighters, parks and recreation workers, custodial services workers, paramedics and emergency medical technicians, anyone providing first response medical care, home health care workers, employees assigned to first aid response duties by their employer, other workers assigned duties putting them at risk of occupational exposure. How does contamination occur? What risks do you have on your job that pose a hazard or expose you to blood-borne pathogens? How does exposure occur? Cuts from contaminated sharp items, knives, broken glass, sharp metal, sharp wires, etc. A contaminated sharp item is any contaminated object that can penetrate the skin. Contact of mucous membranes, eye, nose, mouth, or broken, cut or scraped skin with contaminated blood. Most common exposure is caused by needle sticks. 600,000 to 800,000 needle stick injuries occur each year in the United States. Keep in mind that all employees could come in contact with one or more of these exposure, not just medical personnel. Preventative measures. How do we prevent BBP contamination? Universal precautions. A universal precaution is the prevention strategy by which all blood and potentially infectious materials are treated as if they were in fact infectious. Treat all human blood and bodily fluids as if they are infectious. Must be observed in all situations where there is a potential for contact with blood or other potentially infectious materials. Engineering & work practice controls. These are the primary methods used to control the transmission of HBV and HIV. Engineering and work practice controls should be the first line of defense in keeping workers safe. When occupational exposure remains after engineering and work practice controls are put in place, personal protective equipment (PPE) must be used. Employers must obtain input from non-managerial employees who are potentially exposed to injuries from contaminated sharps and the identification, evaluation, and selection of engineering and work practice controls. Controls. These controls reduce employee exposure by either removing the hazard or isolating the worker. Controls reduce the likelihood of exposure by altering how a task is performed. All procedures involving blood or other potentially infectious materials shall be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of these substances. Mouth pipetting/suctioning of blood or other potentially infectious materials is prohibited. Preventative measures. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses are prohibited in work areas where there is a reasonable likelihood of occupational exposure. Food and drink shall not be kept in refrigerators, freezers, shelves, cabinets or on countertops or benchtops where blood or APIM are present. Preventative measures. Contaminated broken glassware shall not be picked up directly with hands. Shall be cleaned up using mechanical means, such as a brush and dustpan, tongs, or forceps. Tools must be decontaminated after use. Shall be placed into a sharps container for proper disposal. Contaminated reusable sharps shall not be stored or processed in a manner that requires employees to reach by hand into the containers where these sharps have been placed. For example, do not dump contaminated reusable sharps in a sink of soapy water and then retrieve the devices from the sink by hand. Use a strainer basket to hold the immersed instruments, and forceps for their retrieval from the basket. Do not bend or break sharp objects. Personal protective equipment. Considerations. Personal protective equipment. Remember, engineering and work practice controls should be the first line of defense in keeping workers safe. When occupational exposure remains after engineering and work practice controls are put into place, personal protective equipment (PPE) must be used. Be sure to go over all of the personal protective equipment, including how to use it, when to use it, and how to access it. Personal protective equipment (PPE). The employer shall ensure that the employee uses appropriate personal protective equipment. All personal protective equipment shall be removed prior to leaving the work area. When personal protective equipment is removed, it shall be placed in an appropriately designated area or container for storage, washing, decontamination or disposal. Specialized clothing or equipment worn by an employee for protection against infectious materials. Gloves, gowns/safety garments, boots, face shields, eye protection/goggles, mouthpieces and resuscitation devices. Mouthpieces and resuscitation devices must be supplied where employees are expected to perform CPR as an assigned duty. Gowns, aprons, hampers and other protective body clothing. The requirements for the use of personal protective body clothing and the degree to which it must resist penetration are performance-based. The employer must evaluate the task and type of exposure expected and, based on the determination, select the appropriate PPE. Masks in combination with eye protection devices, such as goggles or glasses with solid side shields, or chin-length face shields, shall be worn whenever splashes, spray, spatter, or droplets of blood or APIM may be generated. Personal protective equipment. Gowns, aprons, hampers and other protective body clothing. Small splashes, Spatters and sprays of blood or a pin will usually be stopped by a cotton garment. Larger occurrences creating a potential for soak-through would require a garment of impervious construction. The street clothes must be protected from contamination. Long-sleeve garments shall be used for procedures in which blood or PIM exposure to the forearms is reasonably anticipated. Gloving. Put glove on clean hand. Remove by grasping outside at wrist, pull inside out. With ungloved hand, grasp on inside at the wrist and pull inside out over hand. Gloves shall be worn when it can be reasonably anticipated that the employee may have hand contact with blood, hand contact with a PIM, hand contact with mucous membranes, hand contact with non-intact skin. Perform vascular access procedures. Handle or touch contaminated items or surfaces. PPE maintenance. Utility gloves may be decontaminated for reuse if the integrity of the glove is not compromised. However, they must be discarded if they are cracked, peeling, torn, punctured, or exhibit other signs of deterioration or when their ability to function as a barrier is compromised. All personal protective equipment must be carefully checked before use to ensure that it is in good condition. PPE may not be used if damaged beyond repair. PPE must be properly cleaned, laundered, repaired, and disposed of at no cost to the employee. PPE must be removed when leaving the area or upon contamination. Housekeeping. Proper cleanup is the best way to prevent contamination. Housekeeping procedures. The employer must determine and implement an appropriate written schedule for cleaning and method of decontamination based upon location within the facility, type of surface to be cleaned, type of soil present, task or procedure being performed. The term worksite refers not only to permanent fixed facilities, such as hospitals, offices, etc., but also include temporary non-fixed workspaces such as mobile offices, ambulances, etc. Housekeeping. Effective use of disinfectants is an important factor in preventing healthcare-associated infections. Justification for using a disinfectant. Needed for surfaces contaminated by blood or a PIM. Disinfectants are more effective in reducing microbial load. Detergents become contaminated and result in seeding the patient's environment with bacteria. Surfaces may contribute to transmission of epidemiological microbes, for example, Ver, MRSA, C. difficile. Housekeeping disinfection. Meticulous disinfection and hand washing will prevent transmission. Work surfaces must be decontaminated with an appropriate disinfectant. After completion of a task or procedure. When surfaces are contaminated. At the end of the work shift. Who washes hands more? After using toilet. Women 74%. Men 61%. New York City 60%. Chicago 78%. New Orleans 69%. Atlanta Braves game. Women 89%. Men 46%. Housekeeping disinfection. In the U.S., to comply with OSHA's rule on blood-borne pathogens, a blood spill must be cleaned using a disinfectant. Blood should be disinfected using an EPA-registered disinfectant, a disinfectant with a HBV/HIV claim, or a solution of bleach between 110 and 100 with water. The lists of EPA-registered products are available from the National Antimicrobial Information Network. Housekeeping. Protective coverings used to cover equipment and environmental surfaces shall be removed and replaced as soon as feasible when they become contaminated, or at the end of the work shift. Bins, pails, cans, and similar receptacles intended for reuse which have a reasonable likelihood for becoming contaminated with blood or a PIM shall be inspected and decontaminated on a regularly scheduled basis, and as soon as feasible upon visible contamination. Standard microbiological practices or regulated waste shall either be incinerated or decontaminated by a method such as autoclaving known to effectively destroy blood-borne pathogens. Warning signs and labels. Warnings. Containers of regulated waste. Refrigerators and freezers containing blood or IPM. Other containers used to store, transport, or ship blood or IPM. Contaminated equipment prior to shipping. These labels shall be fluorescent orange or orange red or predominantly so, with lettering and symbols in a contrasting color. Red bags or containers may be substituted for labels. Labels shall be affixed as close as feasible to the container by string, wire, adhesive, or other method that prevents their loss or unintentional removal. The standard requires that warning labels be attached to signs. When other potentially infectious materials or infected animals are present in the work area, a hazard warning sign incorporating the universal biohazard symbol shall be posted on all access doors. The employer shall post signs at the entrance to work areas, which shall bear the following legend: name of the infectious agent, special requirements for entering the area, name, telephone number of the laboratory director or other responsible person. These signs shall be fluorescent orange red or predominantly so, with lettering and symbols in a contrasting color. Laundry procedures. When a facility uses universal precautions in the handling of all soiled laundry, alternative labeling or color coding is sufficient if it permits all employees to recognize that the containers require handling in compliance with universal precautions. Handle contaminated laundry as little as possible, and use PPE. Laundry must be bagged or containerized at the location where it is used. Laundry must be placed and transported in labeled or color-coded containers. Exposure procedure. Exposure procedure. Blood-borne pathogen exposure control training log. Exposure incident report form. Post-exposure evaluation by health provider form. Post-exposure referral to health provider form. Hepatitis B vaccine declination mandatory. Sharps injury log. Exposure procedure. At a minimum, the log must contain, for each incident, type and brand of device involved, department or area of incident, description of incident, Sharps injury log. Disease prevention. Medical record keeping requirements. Employee's name and social security number. Employee's hepatitis B vaccination status. Results of examinations, medical testing, and post-exposure evaluation and follow-up procedures. Healthcare professional's written opinion. Information provided to the healthcare professional. Employee medical records must be kept confidential and not disclosed or reported without the employee's written consent, unless required by law. Medical records must be maintained for duration of employment plus 30 years according to OSHA's rule governing access to employee exposure and medical records. Hepatitis B vaccination requirements. The city must make available, free of charge at a reasonable time and place, to all employees at risk of exposure within 10 working days of initial assignment unless employee has had the vaccination. Antibody testing reveals immunity. The vaccination must be performed by a licensed healthcare professional. Vaccine must be provided even if the employee initially declines, but later decides to accept the vaccination. Hepatitis B vaccination requirements. Employees who decline the vaccination must sign a declination form. Employees are not required to participate in an antibody prescreening program to receive vaccination series. Vaccination booster doses must be provided if recommended by the U.S. Public Health Service. Contact your supervisor if you need to schedule the hepatitis B vaccine. Hepatitis B vaccination. The Center for Disease Control states that employees who have ongoing contact with patients' blood or other IPM, and are at ongoing risk for injuries taking place through the skin via sharp instruments, I.E. needle sticks, be tested for antibodies to hepatitis B surface antigens. This testing needs to be done within 1 to 2 months after completion of the 3-dose vaccination series. Employees who do not respond to the primary vaccination series must be revaccinated with a second 3-dose vaccine series, and retested. Non-responders must be medically evaluated. Hepatitis B. The employer's exposure control plan specifically addresses the provision of the hepatitis B vaccine to all unvaccinated first aid providers who assisted in any situation involving the presence of blood or IPIM. This provision is regardless of whether an actual exposure incident has occurred. The post-exposure evaluation and the follow-up for those employees who experience an exposure incident include Hepatitis B, a provision for a reporting procedure that ensures all first aid incidents involving blood or IPIM are reported to the employer. The report must include the names of first aid providers and a description of the incident, including time and place. B. Provision for the Blood-Borne Pathogens training program for designated first aid providers to include the specifics of the reporting procedure. C. Provision for the full hepatitis B vaccination series to be made available as soon as possible, but in no event later than 24 hours, to all unvaccinated first aid providers who have rendered assistance in any situation involving blood or IPIM. Hepatitis B, HBV, occurs when the HBV virus enters the body, multiplies in the blood and infects the liver. Can result in mild illness or permanent liver damage. Most individuals recover. Death does occur in rare cases due to liver failure. Hepatitis B is the cause of up to 80% of liver cancer. How hepatitis is spread. Infected person to uninfected person through sexual intercourse. IV drug users that share needles. Tattooing with unspecialized equipment. HBV/HCV infected mothers passing virus to their unborn child. HBV/HCV infected mothers passing the virus in breast milk. Blood-to-blood transmission through blood transfusion, breaks in skin or through mucous membranes. Hepatitis B can survive on surfaces dried and at room temperature for at least a week. Vaccination is available. Symptoms: yellow eyes and skin, jaundice, abdominal pain and swelling, fever and vomiting, skin rash. Hepatitis C. Serious, sometimes fatal disease that affects the liver. Not as infectious as hepatitis B, but more common. Vaccination is not available. Symptoms: yellow eyes and skin, jaundice, sore muscles, headache, abdominal pain, nausea, dark urine, weight loss, fatigue. How HIV infection is spread. Infected person to uninfected person during unprotected sexual intercourse. Infected intravenous drug users when they share needles and syringes contaminated with blood. Women infected with HIV can pass the virus to their unborn child. As the virus can be transmitted through breastfeeding, breastfeeding is not recommended to infants of infected mothers. Blood-to-blood transmission when the infected blood enters the bloodstream by blood transfusion, breaks in the skin, mucus, or needle sticks. AIDS reduces the body's ability to fight off normal diseases. Transmitted mainly through sexual contact and contaminated needles. Can be spread by contact with infected blood and body fluids. It cannot be transmitted by touch. HIV, which causes AIDS, is very fragile and survives only a short time outside the human body. Symptoms include fever, swollen glands, diarrhea, abdominal cramps, extreme weight loss, skin rash or lesions. Post-exposure. What to do if an exposure occurs. Promptly wash or flush the affected area. Irrigate eyes with water or saline. Report the exposure to your supervisor. Get medical attention from a healthcare professional. Serious exposures will require the initiation of drug therapies that are believed to be most effective when given within a few hours of the exposure. Treatment should begin as soon as possible after exposure, within 24 hours. The Center for Disease Control currently recommends treatment within 2 hours of exposure. I've been stuck. What to do in case of a spill or accident that results in an exposure. Report event immediately to your supervisor, laboratory director, or other responsible person. All spills shall be immediately contained and cleaned up by an appropriate professional staff or others properly trained and equipped to work with potentially infectious materials. Proper PPE must be used. Equipment and tools must be cleaned and decontaminated before servicing or being put back in use. Use a solution of 1/4 cup of bleach per 1 gallon of water. Cover spill with paper towels or rags, then gently pour bleach solution over towels/rags. Avoid splashing and leave for at least 10 minutes. Wash exposed area with EPA-approved disinfectant. Post-exposure follow-up. Document routes of exposure and how exposure occurred. Record injuries from contaminated sharps and the sharps injury log. Obtain consent from the source individual and the exposed employee and test blood as soon as possible after the exposure incident. Post-exposure follow-up. Provide risk counseling and offer post-exposure protective treatment for the disease when medically indicated in accordance with current U.S. Public Health Service guidelines. Provide written opinion of findings to employer and copy to employee within 15 days of the evaluation. Employer responsibilities. Employees are required to do the following under OSHA. Employer responsibilities. Each employer shall ensure that a copy of the exposure control plan is accessible to all employees. The exposure control plan shall be made available to the Assistant Secretary and the Director upon request for examination and copying. A key element of the exposure control plan is the exposure determination. In the exposure determination, the employer is required to identify and document job classifications where occupational exposure to blood in a PIM can occur. This determination shall be made without regard to using personal protective equipment. Employer responsibilities include training employees initially and through annual updates, implementing a written plan, enforcing good work practices, following universal precautions, proper disinfecting practices, and waste disposal, controlling exposures through the use of needle buckets, biosafety cabinets, needleless IV systems, and self-sheathing needles, providing personal protective equipment (PPE), identifying hazards by proper labeling, including incubators, freezers and centrifuges. Must employ and go over good housekeeping. Employers shall provide hand-washing facilities which are readily accessible to employees. Employers shall ensure that employees wash hands and any other skin with soap and water, or flush mucous membranes with water immediately or as soon as feasible following contact with blood or other potentially infectious materials. Employer responsibilities. Training requirements. Provide at no cost to employees during working hours. Provide a time of initial assignment to a job with occupational exposure, and at least annually thereafter. Annual training for all employees shall be provided within 1 year of their previous training. Additional training needed when existing tasks are modified or new tasks are required which affect the worker's occupational exposure. Maintain training records for 3 years. Training. Employers and employees have responsibilities. Training. Material appropriate in content and vocabulary to educational level, literacy, and language of employees shall be used. Training shall be provided as follows. The employer shall assure that employees demonstrate proficiency in standard microbiological practices and techniques, and in the practices and operations specific to the facility before being allowed to work with HIV or HBV. The employer shall assure that employees have prior experience in the handling of human pathogens or tissue cultures before working with HIV or HBV. Training program elements. A. An accessible copy of the standard and explanation of its contents. B. A general explanation of the epidemiology and symptoms of blood-borne diseases. C. An explanation of the modes of transmission of blood-borne pathogens. D. An explanation of the employer's written exposure control plan, and how employees can obtain a copy. E. An explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood or PIM. Training program elements. F. An explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and PPE. G. Information on the types, proper use, location, removal, handling, decontamination and disposal of PPE. H. An explanation of the basis for selection of PPE. I. Information on the hepatitis B vaccine, including information on its efficiency, safety, methods of administration, the benefits of being vaccinated, and that the vaccine and vaccination will be offered free of charge. Training program elements. J. Information on the appropriate actions to take on persons to contact in an emergency involving blood or IPIM. K. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available. L. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee experiencing an exposure incident. M. An explanation of the signs and labels and/or color coding required and used in the facility. N. An opportunity for interactive questions and answers with the person conducting the training session. Training. The person conducting the training shall be knowledgeable in the subject matter covered in the training program. Training solely by means of a film or video, without the opportunity for a discussion period, would not be acceptable. Generic films, videos, or computer programs, even an interactive one, is not considered appropriate unless the employer supplements such training with the site-specific information required. Trainees must have direct access to a qualified trainer during their training. Employee responsibilities. You are responsible for your training to avoid contaminating yourself and others. Employee responsibilities. Attend training. Comply with and enforce the exposure control plan. Be sure to know proper procedures and contacts in case of an exposure. Segregate medical waste properly. Be sure to know facilities labeling codes. Properly select, wear, remove, and dispose of personal protective equipment, PPE. Summary. OSHA's blood-borne pathogens standard prescribes safeguards to protect you against the health hazards from exposure to blood and other potentially infectious materials, and to reduce your risk from this exposure. Implementation of this standard not only will prevent hepatitis B cases, but also will significantly reduce the risk of workers contracting AIDS, hepatitis C, or other blood-borne diseases. The best precaution against contamination is to have safeguard work practices in place to eliminate the exposure to the hazard. When that is not possible, then the use of PPE is absolutely necessary. More information. The Safety Emergency Management Office, 623-773-7679. OSHA website at www.osha.gov.